Can you become pregnant even though your husband has low sperm count? This is a common question that most women ask us when they come to the consultation room, and the answer is yes. And in this video we're going actually to explain why is it possible that you can become pregnant even though your husband has low sperm count. And we are saying this starts by visiting what we call a fertility specialist. So by the time you conclude that your husband has low sperm count, it implies you made efforts to visit the specialist in that field to do the recommended investigations, which include, among others, semen analysis. So you go with your husband. I'm using this because it's always women who are interested, and they always actually do a lot in terms of reminding husbands to come to hospital. So you tell your husband, we go to the hospital, and when you come with your husband, we shall do a couple of assessments to find out why is failing to make you pregnant. And if one of the factors is low sperm count, that means a semen analysis was done, and when they counted the sperm, they found that the sperms were low. And we are saying, if they are low, are they viable to make the egg from the woman, fertilize it so that the woman can become pregnant? Yes, so we have a lot of interventions. We have what we call a medical intervention. So in the medical intervention, it means if we are sure, despite the fact that the sperms are low, but still they are not viable to make the woman pregnant, we can actually do what we call intrauterine insemination. Intrauterine insemination. So in this, we get semen from the husband, try to examine each sperm cell, each spermatozoa, and pick the one which we think in terms of appearance, because if you remember, if you can just give an overview of how the sperm cell looks like. It's like, let me see if I can try to draw for you, but it has a tail, it has a head, it has a neck. So inside here, it has what we call the male pronucleus that is supposed to release, and then fertilization takes place. This tail is for swimming. So we must ensure that all these parts that are supposed to be on a sperm cell are present. And if we pick one which we know that is normal, is the one we shall bring, and according to the woman's ovulation date, or we can do what we call an ovulation test. And if it is positive, we shall do what we call an intrauterine insemination. And in that, you'll be able to become pregnant. Or we can use medications that boost the sperm production. Then there are things that we can do, is doing lifestyle changes. So we talk to the husband. These things are always common, that please reduce on alcohol intake, reduce on smoking, make sure you do some physical exercises, eat balanced diet that is rich in zinc, selenium, things like vitamins. They are really helpful. Then make sure you have an appropriate timing. You should actually watch out for what we call the fertile window of your wife, the fertile window, or in other words, what we call the unsafe days, so that this little sperm you have, they are put to use. That when you deposit them, at the time you're giving them to your wife, that's the time when the ovum is released, so that fertilization takes place, and then the woman will become pregnant. In conclusion, if all that has not yielded much, please consult a fertility specialist for advanced guidance, and then options like sperm retrieval techniques, then you would also like more information that they may share with you in terms of what to do, when to do it, and then at the end of it all, what is the goal? Our goal is to ensure that the woman, you, the wife, you become pregnant, because we all know every family becomes happy if the woman becomes pregnant, and after 1 or 2, 3 years, you have children. You have 1 child, you have 2, you have 3. That's the pride of every married couple. And we shall always be available to help you whenever you need us. So this brings us to the end of this video. That this video actually discusses how you can actually become pregnant despite the fact that your husband has low sperm count. So in conclusion, we ensure that visit the fertility specialist, then do some medications, or when you visit the specialist, some medical intervention will be done to improve your sperm count. If all that fails, we can do an intrauterine insemination. Then we shall advise in terms of lifestyle changes, and then we shall teach you when is the good time to have sexual intercourse with your partner, considering the fertile window or the unsafe days, that are the days when the ovum is in the oviduct, that when the sperm comes, fertilization can occur, and then you become pregnant. This brings us the end of this video, and once again I remain Dr. Siraj, the women's health specialist. Thank you for watching, and again don't forget to click on that button to subscribe, so that you can receive our weekly updates. Thank you.